Welcome to MeloTV. My name's Gershon Kutsi. World Diabetes Day was observed on the 14th of November, and joining us in studio is Dr. Zaraina Solomons, specialist physician, also a keen interest in diabetes.
Thank you for having me.
Thank you so much for joining us right here on MeloTV. We were talking about diabetes, and there is this misconception about diabetes.
I think it's long-standing, and a lot of debunking needs to occur. And I also feel that we need to educate our patients properly. Unfortunately, there's a lot of time constraints, so we often spend less time that is appropriate, but it needs to be a multidisciplinary approach where we educate our patients prior to initiating any sort of therapy. And hopefully then we would sort of see a better response to the therapies out there.
Now, you're saying multidisciplinary action when it comes working with other doctors. But education is key, because when it comes to health, patients, number one, they fear. There's that fear element and the fear factor.
Now, I completely agree with you. Look, it occurs across the board with any illness. But I think that diabetes can become such a complex illness that if it isn't treated correctly, from sort of the onset, you could end up with quite serious complications later down the line. And yes, I've made reference to multidisciplinary approach, but in my practice where we manage predominantly diabetic patients, often I have a dietitian who I work quite closely with. I have a diabetic nursing educator, and pending sort of the degree of diabetes, I often get the assistance of ophthalmologists. We can get the assistance of podiatrists, as well as assistance from the vascular surgeon if it's necessary, and the cardiologist. So it all depends on where you get involved with sort of the management of your patient and what the patient requires at that point in time.
Most of the time too, or sometimes, there's also the underlying issues, because diabetes can be misdiagnosed. Patients live with it. They fear insulin. They fear how they're going to adapt their lives now that they have to be dependent on insulin.
So you know what, I think over many years, as physicians, diabetes has changed. For all intents and purposes, for the layperson out there, there's type 1 and type 2 diabetes. And it could potentially be quite deleterious for the patient if you were to misdiagnose a type 1. But often type 1s present quite differently, and we tend to see it in the younger population group. But there is this entity of older type 1 patients who would benefit from early initiation of insulin therapy. Type 2s predominantly require lifestyle change with the onset of the disease, but often again they could present with a complication because it could be insidious as well. So like I said, you need to individualize according to your patient and who is essentially sitting in front of you. The one thing that I feel is I agree with you in entirety, in the sense that there is a lot of misinformation. A lot of the times patients come to me, they don't want to use their medication because they feel that insulin is causing their gangrene, or it's the metformin that causes their renal failure. And my answers are quite simple. It's your diabetes that's causing all of these complications. And sort of trying to shift the mindset, it's very important in the management of the illness. It's not driving your patient away from the therapies that are on offer. And as I said, is with time that has passed, therapies have changed quite significantly to what was offered before, because it was pretty much simple. It was a biguanide and sulfonylurea, and you added insulin when the sugars were in control. But I often use the analogy whereby I tell patients, if you don't do lifestyle management, you don't eat properly, you don't exercise accordingly, you come and see me every 3 to 6 months, and all I do is I'm going to, all your general practitioner does is increase your doses of insulin or increase your doses of oral therapy. It's pretty much as sort of like loading an empty tank if you're not doing the rest of the stuff that is expected of you. So there has to be sort of a degree of responsibility that one takes with making the diagnosis or being diagnosed with diabetes as well. It's not just a one-way street.
It is up to the patient also, as you said, to make that concerted effort so that you can then say, listen, this is where we are and this is how we can treat your diabetes. You always hear like communities and the older folk always saying, ah man, it's the sugar levels. Ah man, just eat less chocolate, have a soda and it will, it will help you, that spike.
Yeah, so the thing is that if you are diagnosed as a diabetic, there is either a genetic predisposition whereby you are going to develop this disorder of metabolism. And unfortunately, eating the chocolate or drinking the Coca-Cola, yes, is going to cause that sugar spike in individuals who have a predisposition. And you want to avoid it, because what we tend to do is we become complacent. That one sugar spike happening every sort of once a week, or then it becomes every second day, and then it becomes every third day. And unfortunately, we're not aware of what damage it's doing to the rest of our organ systems. And I have this discussion with my patients. And yes, it is a mindset thing. And yes, it may not happen in the first visit. It may not happen in the second. It may not happen in the third. But at some point, the lights need to sort of go on, irrespective of the fact that most times patients are not aware, or they can't see what's going on inside their bodies until, unfortunately, it's too late.
Also, the work that you do with patients, also, we're talking about education talks that you are having. You're just about to have a talk also with like 100 patients,
Yes.
where you are educating them.
So I think education is the mainstay. You don't want to drive your patients away from you. You don't want to be the person who's always going to say sort of like, no, no, no. You need to meet them halfway. One of my professors at Stellenbosch University, he was a great man. He always said, especially with the type 1s, unfortunately, with the type 1s, it's going to be a very long course. And I used to be very hard on them when I was still in my training. And he'd say, take a step back. You need to understand where the patients are coming from. Often, even from a dietary perspective, you need to understand that the diets that patients with diabetes are expected to follow, it's quite pricey and it's costly. So you kind of need to provide them with things that are sustainable, which often involves getting the dietitian involved, because if you can't afford the expensive low GI bread, what are the alternatives? So it's like you said, Diabetes Awareness Month, and a lot of education is required, and that is often what I spend most of my time doing, and the medication is just an adjunct.
You also have this very warm approach in your practice. And I've seen you work also with patients during COVID and in your practice itself. That warm approach is also very important because you want to give a quality life.
The one thing I try to not say or sort of stay away from is driving my patient away. Often, I think I have a good relationship with my patients, whereby if you've come and you've seen me and this is your third visit and your sugars are still sitting about 15, then I'll have a stern, whatever that is, talking to you and go like, okay, look, I've looked at your previous readings, I've looked at your diary, something seriously needs to change. But the first two sort of approaches, like, okay, try harder, someone needs to motivate you. We're not always aware of what goes on once your patient leaves, so it may be harder. So sort of understanding and being empathetic, it's a very sort of important way to manage patients with diabetes. It's a lifelong illness.
We're talking about also patients and education. One of our Melamed staff members, who was based at Melamed Bell, she's a pharmacist. She was misdiagnosed with type 1 diabetes, lost her eyesight. She studied and she's a pharmacist today. Let's quickly just hear what Inga had to say about her diabetes journey.
Hi, I'm Inga van Aarde. I'm a pharmacist at Melamed Bellville. I've been living with diabetes now for 16 years. I was diagnosed just before my 21st birthday when I had lost my eyesight. I had zero vision in my right eye and partial vision in my left eye. Initially, I was diagnosed as type 1 diabetic, insulin dependent, because they had assumed that I've been diabetic since I was a child. Luckily, I came to Melamed Bellville and I found this amazing physician, Dr. Lebor, who diagnosed me as early onset type 2 diabetic. And he has been my physician now for 8 years, and it's been an amazing journey. My journey with diabetes has not been an easy one. When I was first diagnosed, I lost my eyesight, and it was quite a difficult time. I thought I'd have to start learning Braille, using a walking stick, having a seeing eye dog. Luckily, I was able to have corrective eye surgery, and my journey has just progressed and gotten better since then. I've learned how to use my eyes effectively, with all the problems that come along with it. My advice to people out there, if you suspect you have any symptoms of diabetes, don't hesitate to seek help, medical help. It's nothing to be ashamed of. I always say diabetes doesn't know age, it doesn't know race, it doesn't know gender. Anybody can have diabetes. It doesn't matter if you're overweight, if you look perfectly healthy. Please go and get the help that you need.
Doc, there we just heard Inga talking about her journey, losing her eyesight. She can drive today. She's got her eyesight back, had operations, and she wants to educate, and because she wants to motivate people too.
It's admirable. What we need to understand is that diabetes can be quite disastrous in some patients, and unfortunately our eyesight is something that's very important. Losing your eyesight is one of the more serious complications. Developing sort of sensation of pins and needles in your hands and feet is another one of the complications, and you could progress to sort of end-stage kidney disease or renal failure. The more sort of tangible, or the ones that we see quite often, is patients with type 2 diabetes often present with strokes or heart attacks with the onset of sort of their diagnosis. So all of these things are quite serious, they're quite life-threatening, but she's the perfect example of the fact that despite the fact that she has this long-standing illness with life-threatening complications, it doesn't mean that it needs to pretty much be the burden of your life. You can still go out there, you can still achieve like any other chronic illness, because there are means and ways where you can control or overcome what needs to be overcome.
Many people also, they will find out that they have diabetes, stage 1 or stage 2. And it's a mental shift, because it can affect you mentally, because how am I now going to live with diabetes? Just what advice do you have to a patient out there or a family member watching this video that's saying, wow, I'd like to know more about diabetes?
Look, I think the first part of the journey would be acceptance. You need to sort of realize that this is potentially going to be something that may be well controlled, or this is going to be something that you're going to be living with lifelong. But as I say, with the advent of what's been going on, it's exciting. I've just arrived back from Stockholm. I attended the International Diabetic Conference. It was amazing because there's so much new therapies that we could offer our patients. And often, like I said before, there were very limited options that we could offer our patients. So it doesn't need to be a life sentence, being diagnosed with diabetes. But it means is that it could be part and parcel of your life, and you just need to sort of take responsibility and be a bit mindful of the fact that you can't sort of, indulge badly every single day. You're allowed to sort of have a little bit of an indiscretion, but for the most part, we need you to maintain that level of responsibility. But it's not a life sentence at all.
Dr. Zaraina Solomons, a specialist physician at Melamed Gatesville, a keen interest in diabetes, and maybe one of these days she'll have her own fashion line. Thank you so much for joining us right here on MeloTV. Please like and share this video. Until next time, as always, take care of yourself and take care of your loved ones. Goodbye.